With over 630 confirmed Mpox cases, Uganda is grappling with outbreaks centered in Kampala metropolitan areas as well as districts like Palisa and Nakasongola. According to Health Minister Dr. Jane Ruth Acheng, children aged 12 and above will be included in the vaccination program, marking a significant step in safeguarding communities.
Uganda will be receiving Mpox vaccines before the end of this calendar year. We have 2,000 doses that will be coming in through the African CDC and another 10,000 doses that has been allocated through Gavi. These vaccines will be used to target mainly the population that is at risk. And when we talk about the population at risk, we mean the areas where the infection rates are a little high. That is areas in Bwaise and Naweru, that is within Kampala, and then other areas in Nakasongola, and a few areas in Palisa, and a few other districts where infection rates are going up.
The National Drug Authority granted emergency use authorization for the MVA-BN Mpox vaccine for immunization in individuals aged 12 years and above on 23rd October 2024.
This authorization followed a joint assessment by different drug regulators where National Drug Authority took place, but also a joint assessment that was coordinated by the African Vaccine Regulatory Forum and the World Health Organization Regional Office for Africa.
CDC Country Director Dr. Mary Boyd explains that the vaccine is inactivated and administered in 2 doses 4 weeks apart. It is proven to be safe even for immune-compromised individuals.
The study profile before its initial use in the U.S. and starting in 2022 was determined through looking at its safety profile in thousands of people. So, and some of those people being immunocompromised individuals.
The vaccination campaign will focus on specific groups, including truck drivers, commercial sex workers, health workers, and individuals who have had direct contact with Mpox cases.
It is important that they get vaccinated because in our surveillance we have realized that some of the truck drivers in their interactions along the way get into contact with monkeypox, and they also spread it along the way. And we shall be sending SMS messages to the phones of the recipients to remind them so that they conclude their dose to ensure that they are protected from the Mpox virus.
Apart from vaccination, the CDC and its partners are investing in other measures to control Mpox. The U.S. government has committed $4 million, about 14.7 billion shillings, to Uganda for case detection, management, and risk communication.
Again, we know that stopping the outbreak at its source is important for the country itself, but also important for the global health security.
Dr. Acheng emphasizes prevention, advising the public to avoid contact with infected individuals, sanitize frequently, and refrain from risky behavior such as commercial sex.
Ensuring that we sanitize our hands frequently. The clothing of those who are infected should be avoided or washed with soap and water so that the virus is destroyed immediately.
2 people have died from Mpox and about 138 are still admitted in various health facilities across the country. Walter Mwesije, NTV.